Hi, I'm Wanda. I'm going to be your nurse today. Can I get your first and last name, please?
It's Amy Busby.
Okay, and your birth date? Okay, let me check your armband. Okay, so let me clean my hands and I'll be with you. And how should I address you?
Just Amy.
Okay, Aggie. I'm doing my hand hygiene and I'm putting on my gloves. So Miss Aggie, we're going to be doing an assessment on you today of your thorax. And the first thing I want to do is just inspect your general appearance, okay? So I can see that you don't have any nasal flaring and you're not doing any pursed lip breathing. Your color is even, there's no discoloration, and your nail beds are pink, and there's an angle of about 160 degrees on her nail bed, okay? So I'm going to go ahead and inspect your posterior thorax, and so I'm going to look at your spinous process and your scapula. They're symmetric. Your ribs have about a 45-degree angle in the slope. Okay, and I don't see any accessory muscles being used in her trapezius. And she's sitting upright, relaxed, breathing easily with her arms at her side. Okay, so now I'm going to palpate the posterior thorax, and I'm going to use my 3 fingers. So would you please tell me if you feel any tenderness or pain or unusual sensations?
Sure.
Okay, so starting here at the apex of your lungs, I'm going to go symmetrically down bilaterally. No pain?
No pain.
Okay. Okay, so I didn't feel any crepitus. I don't see any lesions. I don't see any masses. And that her temperature was equal and bilateral. Okay. So now I'm going to take the ball in my hand and I'm going to have her say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, fremitus was equal and bilateral. Okay, so now I want to observe for the expansion of her chest wall. So I'm going to take my hands and put them on her chest wall at about T9, and I'm going to have her take a deep breath, and I'm going to observe for the movement of my thumbs. Okay, I'm going to turn you just a little bit, Aggie. Excuse me, I got to get on my little chair over here. So I can see. All right, take a deep breath for me, Aggie. Okay. That was bilateral, it was equal, and I saw that my thumbs moved about 5 centimeters symmetrically. So now we're going to move on to the percussion part of our posterior inspection assessment, and I'm going to be looking for a tone. It's called resonance. Now, if I hear any dullness, then I'm either over a bone or maybe there's some compaction in her chest or hyperresonance like emphysema, but we're hoping we don't hear any of that today and just resonance. So I'm going to take my middle finger and place it here, and I'm going to tap on it. Okay, so I didn't hear any dullness, and didn't hear any hyperresonance, so that we're good there to go on to the next thing. So now I'm going to have my patient breathe out forcefully and hold her breath in just a moment. Not yet, Aggie, I don't want you to pass out. And I'm going to be checking for the placement of your diaphragm I'm going to start on your right side about T7, and I'm going to percuss until I hear a change in tone, okay? And then I'm going to mark it. Is it okay if I mark on your body?
Yes.
Okay, thank you. All right. Okay, so right about there, let me mark it. Okay, now I'm going to continue percussing till I hear another change in tone. Okay, I'm going to mark that spot, and I'm going to measure it, the distance. Okay, now I'm going to do the same thing over here. You can go ahead and breathe again. Okay, so take a deep breath and hold it. Got to be quick so your patient don't pass out. Mark it. You doing okay? Mark it. Okay, go ahead and breathe for me. And then measure it. All right. Thank you, Aggie. You doing okay?
I'm doing good.
All right. Now I'm going to osculate your breath sounds. So as I move from place to place, just breathe deeply through your mouth, okay? And so what I hope to hear is just vesicular sounds. Those are normal. Okay, here we go. Take a deep breath. Okay. Okay. I didn't hear any adventitious sounds. I didn't hear any wheezing. I didn't hear any crackling, so that's a good thing. So we're going to osculate some more, and I'm going to do 3 different little tests on you. One is a bronchophony, in which you're going to say 99. The other one's the egophony. You're going to say E, and then you're going to do a whisper 1, 2, 3. Okay. So again, say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. So with that, it was soft and it was muffled. So now can you say E for me?
E. 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 E.
Okay. So that was soft and muffled also, and it didn't sound like an A, it did sound like an E. So the last one I want you to do is whisper 1, 2, 3. Okay. So those were very faint and muffled. Okay, so I'm going to, do you want a drink? Okay. I'm going to turn my client around because we're going to inspect the interior thorax. Aggie, can you turn your chair around for me, please? Thank you. Okay, so the interior, I see the shape, and I'm checking for the shape and the configuration. And the interior or posterior diameter is less than the transverse, so I don't see any barrel chestedness going on. And the sternum is positioned at midline, it's straight, and I don't see any sternal retractions. Okay, The ribs slope downward at about, and they're symmetric. And the intercostal spaces is within 90 degrees. I'm going to go ahead and inspect the pattern of her respirations. They're relaxed, they're effortless, they're quiet, there's a regular rhythm. And I'm going to check her, just give me a minute here. I'm just checking your breathing. Aggie, just be relaxed and breathe normal. Okay, her respiration rate is 18. And I don't see the use of any accessory muscles. Okay. Okay, so I'm going to go ahead and palpate. I'm going to palpate for tenderness and sensation. And so just let me know if you feel any tenderness. Okay. So we're going to start here at the apice of your lungs. No?
No.
Okay. Just tell me if you feel anything. Okay, feel it under here. Okay. So no tenderness or pain? Okay, so I'm gonna now check. I'm gonna palpate some more, and I'm gonna be checking for, you know, if I see any masses or lesions, I'll palpate them. But she doesn't have any. There's none visible. But I want her to say 99, and I'm gonna be feeling for crepitus.
99, 99, 99, 99, 99, 99, 99. 99, 99, 99.
And I was using the ball in my hand to feel for that. Okay, so now I'm going to check for her chest expansion. Just like we did on the posterior, I'm going to put my hands with my thumbs towards her xiphoid process, and I'm going to have her take a deep breath, and I'm going to note the movement of my thumbs and see if they're symmetrical. Okay. Okay, Aggie. Take a deep breath for me. Okay, good. It was midline and they were symmetric. Okay, so now we're going to move on to the percussion part. And this is where I'm going to take my middle finger and place it on different parts of your interior thorax, and I'm going to tap, and I'm listening for that resonant sound again. Okay, so I'm going to start right here, Sue. You want to stay off the bone. Let me come way up under here to this part of your rib. Saggy. Okay. Okay. Good. I just heard the resonant sound. I didn't hear hyperresonance or dullness or flatness. Okay, so we want to osculate your breath sounds. See if there's anything going on inside of there. Have you had any congestion or anything? Okay. So just breathe in for me. Lung sounds. I don't hear any crackling or wheezing. No adventitious sounds. Okay, is that it? Thank you for coming today, Miss Aggie. I'm going to leave and you can go ahead and get dressed, and we'll be back in just a few moments.
Thanks.